you doing? Okay, this is my second attempt. The first one I lost. That is irritating. I got about a third of the way through the lecture and it left. So here we go again. This is the third lecture we've had. The first one was the introduction. I went over the course syllabus. I went over the course information sheet, even though together they're called a syllabus, and most instructors call them a syllabus. I split them. I call the syllabus the one that has the dates and what the topics are and that kind of stuff. I call that the syllabus, and the course information sheet is just what it was. Okay, it's information about the course. And I went over that page by page with you. The second one was the metric system. And we do the metric system because science, especially the health sciences, are all metric. Okay, when we measure something this big, it's 3 centimeters. Okay, it's not an inch. When we weigh somebody in kilograms. Okay, so that's why we do the metric system. And we had a lab on it where I had you go get a ruler and measure things. Okay, and then this one's called the Introduction to Anatomy. It's chapter 1 in your book. And anytime you take a course, you will always have the first chapter, should have the first chapter devoted to telling you what you're going to be learning. So you have an idea you can wrap your brain around. So when we talk about anatomy, it's, oh yeah, it's the parts of the body, you know, eyes and ears and teeth and stuff like that. Yeah, but it's more than that, okay? And what we do in order to teach anatomy is we start with the cell, okay? Because we are made up of trillions of cells, and those cells are made up of chemicals, and those chemicals are made up of smaller chemicals that end up on the periodic chart. Okay, if you took a course in chemistry someplace along the line, they had someplace in the room, they had a table of elements or periodic chart. Those are pure elements. And you take those elements and put them together and you get a compound. You put a bunch of those compounds together and you get a macromolecule, of which there are 4. Carbohydrates, proteins, lipids, and nucleic acids. Good? So we'll start there and we'll work all the way to the systems of the body. But I want to show you what's going to happen here. You're going to have 2 types of lectures. The one like we did with the metric system where it was on the board and I was writing and putting markers in and doing stuff. Okay? That's one type. I call that directed teaching. And the other one is PowerPoint. If we have a PowerPoint, I'm going to be right here in the corner and I'll talk to you about what's on the screen. Okay? Sometimes I do 2. I present it both ways. I'll go part of the way through with a PowerPoint, part of the way through directed teaching. Whatever I feel works the best is what I'll do for you. Regardless, all of your stuff is online. Okay? Okay. Now, what I would suggest you doing is setting it up to where you have the computer someplace and then having a notebook, you know, a line paper on one side and your textbook open on the other. That way you can, one of the advantages of being online is you can pause me when you hear something. But regardless, take notes of everything that comes out of this mouth. Okay? Everything we talk about, some way or another, I'm going to assess you on. That means test. Okay? So take good notes. When I say that's a good question for an exam, put a little asterisk in the margin so you can look at your notes and know, oh, I remember him saying that. And that way you really know that part. Good? So don't just sit here and watch the video and think that you're absorbing it. It ain't going to happen. Okay? We have 4 weeks. That's 3 weekends. 4 weeks, 3 weekends. You have to live this. Okay? So here is the 3rd lecture. It's called Introduction to Anatomy, chapter 1 in your textbook. Okay? Now, there we go. There we go. There we go. Now, this is, I think, the 4th edition of McKinley. We're on the 6th edition. 4th 5th, 6th, they'll all work, okay? If you go through our bookstore, I kind of worked out a deal with the publisher where you get the code. The code is good for 1 semester, and you get the hard copy, even though you put it in a binder, it's loose leaf, okay? It's loose leaf, you get to keep that, but the code will shut off after a certain period of time. Reason for the code, 2 things in a normal spring, fall. I have online assignments, so you have to read the chapter and then answer questions, and I give you points for it, okay? Because we are talking about such a small amount of time, 4 weeks, I had to eliminate that for you, okay? So that you may think, that's good, but it kept you on task. Regardless, you don't need the text for online quizzes because there is none. However, it's an electronic version. So wherever you go, you have your phone, you can read or see the chapters that we're discussing, okay, on your computer. It's pretty cool. And it comes with it. So if you buy the text, it comes with the code at the bookstore. If you buy the text online or a buddy has one, it won't have that, so you'll lose that option, but you'll still have the text. Will you need a text? Absolutely. Because some things I say just don't quite gel in your brain, you can go to the textbook because I follow it. You can use other human anatomy textbooks, but the one I'm showing you pictures of or images of or the structure of comes out of McKinley. Okay, so that being said, this is McKinley's 4th edition. You can have the 5th, which we used last semester, or the 6th, which is now going to be used. Okay, now each time I do a PowerPoint, I'll start with I'll have the chapter and I'll say an outline. Now I know that you have had some instructors that throw up a slide and it has all this stuff on it. I almost said crap. Has all this stuff on it and they read it and you're fighting to keep your eyes open. We don't do it that way. I do bullets. I'll do a bullet and I'll ask you what you think. Now, if you really want to be engaged, you pause it and you think of the answer. Unpause it and then you'll hear me tell you the answer. Okay? If I just tell you the answer, you're not thinking. This material is not becoming part of you. Are we good? Okay? You don't have to do it that way. I'm just telling you what way it will work. All right. So here's an example. You see that first bullet? It says definition and approach to anatomy and physiology. So that means I'm going to give you a definition of anatomy. I'm going to give you a definition of physiology. Okay? And we'll talk about it a little bit. Next bullet, body organization. Okay? Pause. How is the body organized? Well, hell, I don't know. Eyes and ears? No. Remember that chemistry we were talking about? You're made up of chemicals. Those chemicals come together and form a compound. Those compounds come together, form macromolecules. Remember there's 4 of them. Okay, remember that? That's the second time I told you. That means you're going to get it on an exam. Then we take those macromolecules, put them together and make a cell. And we have little workers in the cell called organelles. And those are made out of chemicals. And they each have a job. And we take those cells and we put them together and guess what? We make an organ. And then we take organs and put them together and we make a system. Then we have all these systems, of which we're going to call 11 systems. We have 11 systems. We call that an organism. That organism is you. Yes? Okay. That's how the body's organized. I'll show you this. Organ systems. Organ systems. Okay? So after we put the body, we put the organ systems, we said there's 11. Old school, there's 9 because they put the urogenital together. So that took 1 away. That was 10. And then they put the endocrine system. Was not a separate system. So that made 9. Okay? We're going to do 11. Okay? They're the ones that are established. Okay. Then we're going to spend quite a bit of time talking about anatomical positions, planes, and body cavities. Let me explain real quickly. When we talk about the anatomic position, or anatomical position, we have to have a starting point. Okay? Where does the body start when we say we move? We flex, we extend, we pronate, we supinate, we hyperextend. It has to have a starting point. And the starting point is standing erect, feet flat on the ground, eyes forward, arms to your side, thumbs outward. So in other words, your palms are forward. That's the anatomical position. Okay? Now, whenever we move from that, we have a name for it. And you've known some of them like flexion, extension, hyperextension, abduction, adduction. I'll go over all those for you. Okay? It actually comes out of the chapter on articulations, which I think is chapter 5. But I brought that section into here so we have an understanding of some of the things of our discussions. We'll hit it twice. We'll hit it here, and we'll also hit it when we do articulations, which are joints. Then we have planes. When we talk about where things are in the body, we have to be able to cut the body open. And we can cut it from side to side. And that plane that does it, think of a plane as a machete or a cleaver, okay? So if I was to take and cut myself right here, that would be a sagittal plane, and you end up with right and left halves. If I cut myself here, front to back, there's a front to back of me, that is a coronal plane, okay? If you cut me up like a loaf of bread, that's a transverse plane. You see where I'm going? So I'll explain those and I'll give you a picture of them. And you know I got to ask a question on the exam. And then body cavities. We have an anterior cavity. We have a posterior cavity. We have a thoracic cavity. We have an abdominal cavity, yada, 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 yada. Okay? The one that has the most stuff in it, the most organ systems in it, is the abdominal cavity. So we're going to break that into 9 segments, okay? 9 little regions, and I'll do that towards the end of this lecture. Okay, so that's what that bullet's about. Okay, the next bullet, proper names for movements. Remember we talked about anatomical position? Well, when you move, what is that called? When I shorten the angle, that's flexion. When I increase the angle, that's extension. Okay, when I move to the side, that is abduction. When I move it back, that is adduction. You see? You see? So we have names for all that. We'll do that. Okay. All right. First one, definition, anatomy, physiology. Well, here we go. You guys ready? Start taking notes. Anatomy. First thing we got to do is got to have a definition of anatomy. You know, they said that after this coronavirus thing goes over, you're going to be one of 3 things: a chunk, a hunk, or a drunk. Okay, I lost weight. Yes, sir. I lost weight. Okay, so I drink this stuff here. Yeah, yeah. You know, when you go to Costco, you buy the big. I think there's 36 of them. The best one's berry. Okay, they only give you like 6 of them, and they give you the darn things like lime and orange. So I got the big bottle. Yep. So hang on. That's good stuff, man. Guess how many calories? Guess how many calories? It's water. Take a guess. 0. I want to get the body back I had when I was 20. I'm almost there. If I could do something with this turkey neck. Lost weight and now I got a big turkey neck. Anyway, anatomy is the study of structure. We're thinking, oh, what's anatomy? Well, that's the parts of the body. Yes. And they have names. Yes. Okay. So it's the study of the structure. What is the heart? What does the heart do? What is the lungs? What do the lungs do? You get it? Okay. It has a meaning. Now, all of our meanings we have in English language come from Latin, because Latin's a dead language. It doesn't change. We also sprinkle it with a little bit of Greek. Okay. So anatomy means to cut up and cut open. Okay. When we talk about function, that's physiology. I think that's one of the most difficult courses for us because you have to be able to think outside the box. But anyway, it's function, and that's physiology. But a lot of times with anatomy, I'll throw in function so you can understand how the systems work. Okay, one of the biggest ones I'll do is when we do the anatomy of the excretory system, the kidney. The best way to understand that is how does the kidney work, and then we're into function. Okay, so I'll tell you that as we go along. Some of it will just be straight. This is what it's called. Okay, physiology, study of function. So the way the systems are set up for you is you take anatomy first, you take physiology second. That way in physiology, they don't have to teach you What is the outside of the kidney called? Cortex. What's the inside called? Medulla. And I'll teach you that. Then go and say, okay, in the medullary portion of the kidney is the loop of Henle. You see what I mean? And that's how we cleanse the blood. So we learn in physiology, study of function. That's a tough, okay? Physiology's tough. You can do it though, okay? Therefore, anatomy and physiology are interrelated. I used to like it. I teach, as you know, I teach, of course, anatomy and physiology together for the dental hygienists and kinesiology majors and stuff like that. That's the best way to do it, okay? That's by far. Teaching anatomy and physiology together, it's like giving you the storylines and how the things work, okay? But some powers higher than me said if you want to get into the nursing program, you have to have them split, okay? So probably 15, 20 years ago, they split them. Otherwise, you used to be able to take anatomy and physiology together. Anyway, that's that third, that dash there. Anatomy and physiology are interrelated. You can't have one without the other. Okay, 2 categories of anatomy. Microscopic anatomy, you got to start with a cell. You can't see the cell with your eyes. You got to use a microscope. Got it? So microscopic anatomy is where we start. We do the metric system, and we talk about what is anatomy and that kind of stuff. But when we physically start investigating the human body, we start with the microscope. We'll identify a cell. We'll see how does the microscope work. How can we estimate sizes with the microscope? And then we'll look at tissue. And then when we get to tissue, we'll go to the first system in the body, which is the integumentary system. And we have to look at the skin under a microscope. Got it? Okay, so there's one. Structure's too small to be seen with the unaided eye. Duh. Cytology, okay? Cytology, whenever you see ology, it means study of. Cyte means cells. Cytology is the study of cells. And histology is a study of tissue. We have a whole section on that, okay? So cytology, histology, cytology, cells, histology is tissues. Good. Now, if you get into upper division, you can take a whole semester on this. And let me tell you, it isn't riveting. I had to do both, okay? But it's what I would teach you about cytology and histology. It's just a little bit, but it's enough so you're educated and you understand about it, okay? If you decide to go into that branch, then you'll go in to take another course in just that. Good? Okay, and then gross anatomy. So here's the 2 categories. Microscopic anatomy. Let me get this. Microscopic anatomy and gross anatomy. Gross anatomy is things you can see with the unaided eye. Okay, that means you can look at it. A bone, a femur, okay, gross anatomy. Eyeball, gross anatomy, get it? Structures that can be seen with the unaided eye. Okay, is there any test question there? Probably not. Maybe cytology, histology. All right. How are we going to do this? How are we going to do this? Our approach. Well, people have tried to make it. Anatomy is not a walk in the park. If this is the first science course you've taken, hold on to your pants because it's going to be kind of tough, okay? But you can do it. You just have to be organized and you have to be self-motivated, okay? So, regional anatomy. This was a big thing. I don't know if you ever heard of ADAM, A-A-D-A-M. It was a computer program that was 3-dimensional that allowed you to go in and see the different structures in the head and in the chest and in the abdomen. It was regional anatomy. They tried it. They tried to make that, they thought that would be the easiest way to teach the subject. So the instructors that learned it that way sometimes teach it that way, okay? I didn't learn it that way, and I don't think it makes sense. They tried to have me do it that way. I said, just try it. It just doesn't work because you have to know. Here's an example of regional anatomy. Let's say we're looking at the head. You'd start with the skin, go this way. And so what you're doing, I'm gonna turn myself sideways. What you're doing is you're going this way. So as you clicked on your mouse, you went deeper and deeper and deeper until you got halfway, and then you start going out the back side, okay? So you had to know about the sensory organs, eyes, nose, taste. You had to know about the integumentary system, okay? Then you had to know about the circulatory system. Then you had to know about the nervous system only here. Okay, so then when we went to the chest, you had to know about the circulatory system again, and you had the respiratory system. You had the respiratory system in the nose. It just became, it's like you had to learn it all at one time and then go back piece by piece. I didn't like it. And you're not gonna have to learn it that way. So, hey, I'm just talking about it, okay? That's regional anatomy. Taking one region of the body and learning it inside out. Study of structure within a single region, okay? Head, neck, abdomen. I just gave you those. We good? We good? So you know what regional anatomy is. I might throw a question like that on the exam just to see if you're paying attention. And then surface anatomy. This one's an oddball. They put it in your book. McKinley put it in a book. I don't know why. Surface anatomy means what's all going on in the skin. Okay. Now we know the skin is semi-permeable. It keeps things out. It blocks ultraviolet rays out. It has sweat glands in it. It has a whole bunch of stuff. But we do surface anatomy. No. We do that with the integument and the subject. But in your book, it's there. So there's 3 of them. Okay. Study of internal structures, the locations relate to the regions of the skin or other surface markings. Okay. Okay. Ridges on your finger. Yeah, like fingerprints, ridges. They're called epidermal ridges. Okay, we cover that in the integumentary system. Here's the one we're going to do. Systemic anatomy. That means systems. Okay. The integumentary system, the muscular system, the skeletal system. Get it? The nervous system. That's the way we'll approach it. So it's the 3rd one, but I want you to know which each one is, okay? Study of structures involved in a specific activity. That means like circulatory, respiratory, that kind of stuff. Digestion, reproduction. Okay, good. All right. This picture is kind of shows you, now we're back to structure. How is the body structured? Remember I said we started with an atom? Remember the thing on the periodic chart? And we took those atoms, those elements, put them together, and we formed a compound. Okay, that's this guy right here. We formed a compound. We took those compounds together, and there's another one in between here called macromolecules. Those made the cells. Macromolecules made cells. Cells made tissue. Okay, a tissue made a system. System went into an organ system, and then we had the dude. Okay, the organism. That's the way your body's put together. Okay, now I'll show you on the side just what I just said. We have atoms. Okay, that's what you find on the periodic chart. An atom of iron, an atom of calcium, an atom of oxygen. Okay, those are atoms. We put those atoms together, we get molecules, compounds, molecules. Good? We take those together and we get a cell. Now, in between there's one called macromolecule, but we're going to go with this. Okay, we're going to go with this. Okay, so atoms, molecules, cells, tissues. Okay, we put cells together, we got tissues. Put like tissue, like L-I-K-E, like tissues together, we get organs. We put organs working together and we get a system. We have systems put together. Guess what? We have an organism. Okay, got it? Okay, I will ask you one question on the exam on that. Probably which one is out of order or which one is missing. Okay, so you got to know what, 7, 2, 4, 6, 7, yeah, there's 7 steps. Okay. Okay. Living organisms. What makes something living? Positive. I want you to think about it. What makes something living? Now, you didn't pause it. I know this. I'm looking. I can see you. You didn't pause it. Okay? Living things. Do they grow? Are they organized? Do they evolve? In other words, change, adapt. Do they reproduce? Okay, those are some, they metabolize. You're going to see, I'm going to list them right here. But you're thinking, okay, we just got off that COVID virus thing. Okay, is a virus a living thing? Never thought about that, did you? It's not. It's kind of caught in the twilight zone. It's living and non-living. Here's what I mean. A virus can evolve. That's living. A virus cannot reproduce. That is living. So a virus, the only way it can reproduce is it has to go into a host cell or a host and use its reproductive machinery. You see? Okay. Anyway, organization, talk about things, metabolism, growth, and development. Yes. Responsiveness, responds. Something that's living responds. Somebody hits you upside the head, are you going to respond? Okay? I don't know. Man, I got things going. I got 2 computers going, and people are still bugging me. Anyway, responds. Look at this one. Adaptation, evolve. Now, we're not getting into Darwin, and we're not getting into the Bible. What we're trying to tell you is, do living organisms adapt? Adapt is evolve. You change. Change through time is the definition of evolution. Things change through time. Okay? Anyway, adaptation or adaptation. And the last one, regulation. The last one is reproduction. Okay? You regulate things, which is a good example already how your kidneys work. And then reproduction. Okay? Got to reproduce your species. Okay. Now, next thing, there really isn't anything to take notes on. This is kind of like ooh, wow. These are the 11 systems I was telling you about. Okay? So I have pictures. There are 11 organ systems, how we're going to recognize it. And have a picture of males, females standing there. Now, these are not real. Standing there to show you, it's going to emphasize what the system is. Okay? So each system contains organs that work together to perform specific functions. Okay? Each system contains organs that work together to perform specific functions. The heart is not a system. The cardiovascular is a system. Cardio heart, the blood vessels that take it around, vascular, cardiovascular. That is a system. You see. Okay? All organ systems work together, make up the organism. Now, this emphasizing that dude with a cup of coffee. Okay? All right, here we go. Here's the first 3. Lower left-hand side, integumentary system. Integumentary system. Okay? That's the skin. That's the first system we'll talk about. The next system we'll talk about is the skeletal system. There it is. And the last third of the semester will be the muscular system. Okay? The muscular system makes the skeletal system move. Okay? Lower left, nervous system. That's a toughie. It takes me almost a full week. Remember, we only have 4 weeks. Okay? Almost takes me a full week to get that one through because we have to learn about what is the nervous system, what's it made of, blah, 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 blah. Then I do the brain, and then I do the spinal cord, and then I do motor nerves, and then I do autonomic nervous system. So it takes time. Okay, it takes time. It's a toughie. Don't blow it off because that's going to be on your exam. The next one is the endocrine system. That's why you see, I'll kind of show you with the arrow here. You see a stomach and you see a kidney, and there's probably a spleen over here and a heart and a throat, which is the thyroid gland. The endocrine system, I do not take and discuss that. I sprinkle it as we go through the semester. Okay, so I talk about that's endocrine and this is what it is, da, 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 da. Okay, then the next one's the cardiovascular. That one's straightforward, yeah. Lower left, the lymphatic system. That's the second one that I do not do. When I talk about the lymphatic system, I'll do it with the circulatory system. Lymph, L-Y-M-P-H, okay, is blood that's escaped the circulatory system. So when it goes through a capillary bed, if some of it leaks out, it's not called lymph. It's lymph all the way until it gets back in the circulatory system. It's called blood. Pretty simple. Your lymphatic system is a system kind of like your circulatory system, and it circulates lymph and it circulates white blood cells. Okay? The middle one is the respiratory system. That's kind of short and sweet. Okay? Begins with your nose, goes into your lungs. Okay? For those of you vaping, okay? Your lungs don't look like healthy like that. Okay, the next one is the digestive system. It's one of the last systems we do. The kidney, the urinary system, lower left. Okay, not a lot there, not a lot there. That's the one I told you I do a lot of physiology on that one, so you understand that. Okay, and then we have the male and female reproductive systems. Those are the last two systems we'll discuss because that's when you're more mature. Okay. Okay, anatomic position, anatomical position. Here she is. Palms forward, thumbs outward, feet flat on the ground, eyes forward. Yeah, yeah. Characteristics, here you go. Here you go. We said it was coming. Standing upright. Feet parallel and on the floor. Head level and looking forward. Arms at the side of the body. Whoa, whoa. Here we go. Here we go. Palms facing forward and the thumbs pointing away from the body. Okay? Now, I hate to tell you this. The only way that you can get your thumbs pointed outside to the outside is your palms forward. You can't do it the other way. Okay? You might get close, but you ain't going to get there. Okay? So if your thumbs are out, your palms are forward. All right. Remember we talked about planes? I said like a machete or a cleaver. Okay, here we go. Here we go. It says use to visualize an internal 3D body. What it's saying is, if this is how we look at the inside of your body. Okay? If you take a sagittal plane, cut the body in half, are we symmetrical? You see what I mean? So we have to talk about that. The sagittal plane. A section. A section is what happens when you cut it. Okay? If I was laying down in front of you and you chop me up like a loaf of bread, could you take a section of me out and look at it? Yeah, that's how you see. That's what an MRI does, or a CAT scan. Okay, they take sections. Plane. Okay, plane is the machete or the cleaver. Okay, so what we do is we say we take an imaginary plane and we slice the body in certain directions to see what it looks like inside. Okay, here we go. Coronal, also called the frontal plane. Now watch this, because what I try and do is, if there's two names for something, I try and put the next name right next to it in parentheses. Okay, so coronal, frontal. Got it? That's this one. Okay, coronal frontal. Divides the body into an anterior front and posterior back. Okay, so think of it going from shoulder to shoulder, what it results in. Transverse, also called horizontal plane. It's cross section. Okay, sometimes if you look at a microscope slide, it'll say CS on it. It means it's a cross section. We do that when we look at the intestine. Okay, transverse. Okay, divides the body into superior, upper, and inferior, and lower parts. Okay, unless you're laying down. Okay, just think of a slice of bread. There you go. Sagittal plane. Okay, I got to talk about this one because every textbook, I used to review textbooks, read them for accuracy. Everyone does the same thing. They say a sagittal plane cuts you in the right and left halves. Okay, comes down like, okay, and then they say there's a mid-sagittal plane. And I say, time out. A mid-sagittal plane would mean the one that absolutely goes right down the middle. That is a type of sagittal plane, but your book separates it out. We're not going to do that. Did you get it? Okay, here's what I mean. Divides the body into unequal left and right halves. A sagittal plane divides the body into unequal left and right halves. If it does cut it exactly into equal right and left halves, it is called a mid-sagittal. That's why it's not in green, it's in bold print. Okay, mid-sagittal, if you cut away the mid, you still have sagittal. Okay, now I've spent some time talking about this. Do you think you might see it again later? All right. Oblique plane. Oblique plane cuts you on an angle. Okay? Cuts you on an angle. So you're not cut this way, transverse. You're not cut this way, sagittal. You're not cut this way, coronal. You're cut on an angle. Okay? Passes through the specimens at an angle. All right. There's your planes. 1, 2, 3, 4. Are we good? We good? Okay. Now you know you're going to see those. Somehow you're going to see that again. Okay. So I go, oh, I didn't know he was going to do that. Okay, it's green. Hello. All right, body planes. Here's a picture. Okay, and they use the head. But what I want you to see is, you see this blue one right here? Okay, that's a coronal plane or a frontal plane. You're going to end up with a front and a back. See this pink one? This pink one? Okay, that's a sagittal plane. Okay, that's a sagittal plane. You see this one here? The green one? That's a transverse plane. Transverse, cutting you up like a loaf of bread. All right, good. There's pictures. Goes with what we just talked about. Okay, anatomical direction. I'm going to do this in two ways. I'm going to do opposites, and then I'm going to do things that mean the same thing. Okay? So anterior is towards your front. You're going to see another word for it is ventral. But anterior, opposite, posterior in the back. Good. Superior, up. Inferior, down. Good. They're opposites. Medial, lateral. If you're in the middle, that's medial. As you move to the outside, you're moving laterally. Okay? If you're on the outside and you're moving towards the middle, you're moving medially. Yes? So watch this. Watch this. I'm moving medial, 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 lateral, lateral, lateral. You see? I went past the midpoint. Medial. Okay? Okay? That's medial. If I move this way, you can't see my finger. Move this way, moving lateral. If I move this way, I'm moving medial. We have a word for that. It's called abduction. Adduction. I'll get to that in a minute. Did I tell you about what's behind me? I'm talking to you from the Great Wall of China, Jacko. Yep, I'm sitting right out there on there. Right to nice weather here. Yeah, nice weather. Yes, a little misty. You can see that. Yeah. Okay. I've been there. I've been there. In fact, see that person standing there? That's my honey. Yep. I went there a couple years ago. I'd suggest you go. Right now, I wouldn't go. A little bit uneasy, but cool place. Cool place to visit people. Very, very nice. Proximal distal. Okay. My hand. My hand is distal to my wrist, which is distal to my elbow. You understand? Further away, distal. Closer to, proximal. Okay, now what I'm going to do is I'm going to throw some naked people here for you to look at. And don't look at that, look at the arrows. Okay? We have anterior, posterior, superior, inferior. Get it? Get it? Medial, see, moving. Now, it doesn't mean that is medial. That line is the only thing that's medial. It means moving in that direction is medial. Moving away from the midline is lateral. Good. And then we did proximal, which is closer to. Well, proximal is closer to. Okay, that's why that. Where to go? Where to go? Just a minute. I'll go to previous. Sorry about that. Well, that didn't work. All right, that's just a picture. Okay, here's a complete list. Okay, this has, look at all this stuff. All those terms. We did anterior, posterior, dorsal, ventral, superior, inferior. There's caudal, cranial, rostral, medial, lateral, ipsilateral. We'll talk about all of those things in the course of this semester. Good? Good? So there's a list. It's in your book, table 1.2. Good? All right. Here's a bunch more. Oh, you're not, no, there is a bunch of them. Believe it or not, most of these you'll have mastered by the end of the 4 weeks because we need to know those things, okay? And we're describing the body. Okay, body cavities. Here we go, body cavities. Posterior dorsal. Oh, remember I said there was going to be some that had two names? Now, normally I put parentheses around it. This time I just put a diagonal, okay? Posterior and dorsal. There's a cavity back there. Yeah. Cranial cavity is part of it. Vertebral column. Okay, you know your vertebra have a hole in it? You're thinking, oh yeah, I knew that. Well, so maybe some of you don't know that. There's a hole in your vertebra. And what runs down that is your spinal cord. And the hole, when you put them all together, forms a canal. That's called the vertebral canal. If you took my glasses and cut my skull off, the top of this, pop my skull off, there's a cavity in there. That's called the cranial cavity. Now, anterior and ventral cavities. Okay, these are the ones we know most of: thoracic, abdominal. Thoracic, okay, that's where your heart and lungs are at. There's other stuff. That's the main guys in there. And the abdominal pelvic. Now, this is a little bit, let me explain. Abdomen or abdominal cavity, perfect. But they call it the abdominal pelvic cavity, even though the pelvis is not a cavity of its own. But what they did is, if you take right now, take your thumbs, go right in above your waist, your belt line, push in. Now don't just sit there and stare at me. Don't stare at me. Do it. There's a reason. I'm going to bring this up a couple times throughout the semester. You push in. Do you feel that bone? Okay, you say, what is that bone? That's your hip bone. No, you don't have a hip bone, Checo. That's part of your innominate bone. And what you're feeling, your innominate bone consists of 3 bones: the ilium, the ischium, and the pubis. The ilium is what you're feeling, the crest of the ilium. That's what you're feeling right there. If you take an imaginary line from iliac crest to iliac crest, going from your right to your left to your right, everything above that is your abdomen proper, and anything below that is your pelvic area. Good? Okay. The thoracic and the abdominal pelvic area is separated by the diaphragm. If you take right now and feel your last rib, okay? Feel your last rib. Some of us have to poke a little harder to find that rib. Okay, that last rib, that bottom rib, just inside of it, going all the way to your back, is a muscle. That muscle is called the diaphragm. It helps in deep breathing. That separates the thoracic cavity from the abdominal cavity. Are we good? Okay, there it says, the pelvic region is separated by an imaginary line from crest, iliac crest to iliac crest. You did it and you felt it. Okay. Okay, body cavities. Here's a picture of what we just talked about. Okay, here's the posterior cavity with the cranial cavity and the vertebral cavity. And this is the anterior cavity with the thoracic and the abdominal pelvic. Okay, abdominal pelvic. And in the thoracic cavity, we have subcavities. This is the pleural cavity. See it? Pleural cavity, that's where your lungs are at. And this is the pericardial cavity, where your heart is at. Good. Since the abdominal cavity has so much stuff in it, we divide it into regions. And I'm about to show you those. Complete list of the cavities. Okay. Here's all the cavities. Okay. Blah, 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 blah. You can look at that. I'm just not going to read it. That's an insult on your intelligence. Okay, I'm not going to read it. But anyway, read them. You read them. See where it says abdominal and pelvic. I don't know how I keep doing that. Anyway, now we have membranes that go, when I'll ask you this throughout the semester. If something is really important to our survival, we put a membrane around it. Okay, we put a sac around it. If it's really, really important, we put a sac and we put bone around it. Okay? So, is your heart really important? Yeah, we put a sac around it. What's the name of the sac? Pericardial sac. Is the lungs important? Yes. Do we put a sac around it? We sure do. What do we call it? Pleura. The pleural sac. Okay? Is your heart and lungs important for your survival? Yes, it is. So do we put bone around it? Yes, we did. Rib cage. See how that works? Okay? So, there you go. That membrane has a name. It's called a serous membrane. Okay? It's just a common name. Serous, like car. Okay? If I said, what kind of car is that? I just said, oh, it's a car. That's not descriptive. Okay? So serous membrane is the common name that goes for all the membranes. But depending on what those membranes are wrapped around, the sac is wrapped around, it changes that name. The serous membrane is specifically called pericardial sac. You see, pericardial membrane. Okay, and it also has two layers. Okay, has two layers. The outside layer is called the parietal. Now this is deceiving. Look what this says. Lines the internal surface of the body wall. Sounds like it's the inside layer. It's not. It's the outside layer. It's what touches that outside body wall. Okay, the parietal is the outside layer. The inside layer is called the visceral layer, regardless of what it's around. Okay, so we use the example of the heart. Pericardial sac has an outside layer called the parietal layer and an inside layer called the visceral layer. You see. Okay, now, if you've got two layers, you have a space in between. Okay, you have two layers, you have a space in between. What are we going to put in that space? Ain't going to be air. It's not going to be air. It has to be a real slimy fluid because it's going to do two things. It's going to reduce friction. It's going to reduce friction. And the other thing is going to pull away heat. Okay? You know that when your air conditioner comes on, you feel an instant relief. You can feel that cool air hit you. Yeah? You're like, oh man, this is nice. Yeah? What happens when that air conditioner goes off? Oh, hot, don't like. Okay? It's instantaneous. With fluid, it pulls it away at a constant rate. Got it? Got it? That's why it's fluid. Two things. Reduce friction, pull away heat. There it is, right there in front of you. Okay? Okay, here's the cavity. Let me show you what you got. This hand here, what it's trying to say is you start with a single balloon, a single sac. If the sac is underinflated, you know you put your finger in it. Like a balloon. Picture a balloon. You got a balloon that's not filled up too full, and you push your finger in. Your finger goes right on the inside, and now your finger has two layers on. The one touching your finger, which is the visceral, and the one on the outside, which is parietal. You get it? That's what they're trying to show you in this picture right here. Okay? This would be the pericardial, okay? The pericardium, pericardial cavity is where it's at. It has serous fluid in it. It has an outside and an inside with serous fluid in it. In fact, that fluid is going to carry the same name. That's called the pericardial fluid. Yeah. This is still a serous membrane, and the fluid still pulls away heat and reduces friction. We also have it around the lung, but we change the name. Look at this. Parietal, visceral. Look at this. Parietal, visceral. We just changed the end. Pericardium, pleura. You see? Now, around this is your abdominal cavity. Well, you got all kinds of stuff there. This is your intestine, cut it sections. Okay? So this is a sagittal plane, and it cuts your intestine as it weaves back and forth. Okay? That's the sac that goes around it is called the peritoneum. See it? Peritoneum. And you have an outside, parietal, inside, visceral. Get it? Get it? All right. Thoracic cavity. What I'm going to do is I'm going to go through each one of these. I'm going to do them quickly. It's not because it's not important, and it's not because it's not showing up on the exam, because all those things are true. It is important, and it's showing up on the exam, but you can read it. I've already discussed it with you, but here we go. Okay, the heart. The heart is not dead center in your chest. Dead center in your chest is called mediastinum. Okay? So behind the sternum, media in the middle, is not where your heart is at. Okay? It's two-thirds to the left. Okay, it's opposite here. That's 2/3 to the left. Okay? 2/3 to the left. If you learned how to say a Pledge of Allegiance properly, which I think they've taken it out of the school and I dislike it, you take the palm of your hand and you put it right in the middle of your breastplate, which is your sternum. You extend your fingers up on an angle, and that's where your heart is at. 2/3 mediastinum. Okay, so that's what that means. We'll talk about that also when we do cardiovascular system. Okay, okay, and there it is, 2/3. See that? So here's the middle. Let me get the little arrow. There's the middle. See how 2/3 of it's over here? 2/3 to the left, mediastinum. All right, and make a big deal out of it. There you go. Thoracic cavity, again. The pericardium is the sac that goes around the heart. It's 2 layers. 2 layers. Inside one is visceral, outside one is parietal, pericardium. All good. Straightforward. Okay? The space in between, now this is incorrect. I want you to listen. I leave this in here specifically so I can emphasize it because I want you to understand it's a mistake. The space between the layers is not called the pericardial cavity. The pericardial cavity is where it's at in the thoracic cavity. It's in between the lungs in a special place called the pericardial cavity. It says between the layers is a space called what? The pericardial space that contains pericardial fluid. Good, good. Thoracic cavity. It says, note that the heart is outside the pericardial cavity and covered by a visceral pericardium. We're talking about that. Okay. Visceral, this is the old balloon. How'd you get the inside layer? You see that right there? See that right there? That is the visceral layer. That is the parietal layer. This is the space that contains fluid. Okay? Pleura. Now, this is going to be exactly the was with a pericardium. Only now we're talking about the lungs. So instead of pericardium, we take that word out and put in pleura. Pleura. Good? Good? Okay, there's the diaphragm. Remember, right down below the last rib? Someplace here. Okay, that's the diaphragm. And now we're talking about the lungs. The lungs are in the pleural cavity. Thoracic cavity, pleura contains, same thing. Parietal, visceral. Okay, visceral, parietal. Okay, exactly the same. Only instead of seeing, here you see pericardium. Before you saw pericardium, now you see pleura. Only thing, just different. Again, mistake. Pleural cavity. Pleural space has a fluid in it. Guess what that, you know what? Go back to the heart. Remember what that space was called? Pericardial space, right? What did it have in it? Fluid. What was the name of the fluid? Pericardial fluid. What is it when that fluid is infected? Pericarditis. Pericarditis. Okay? What is it when it's infected in the pleural cavity? Pleurisy. Get it? Wow. Feel good, huh? 2 continuous cavities, abdominal cavity, pelvic cavity. Remember we talked about that? Remember me having you put your thumbs on that iliac crest? Okay. It says they're together, but we look at them separately. Okay? Okay, there you see the innominate bone, because I said you don't have a pelvic bone, you have an innominate bone. Okay? Which is made up of 3 bones, ilium, ischium, and pubis. All right. One that goes around all your guts, I call it your guts, it's your intestines, your spleen, all that stuff is called the peritoneum. Peritoneum. Okay? Just like the other ones, you got an outside parietal, inside visceral peritoneum. Are we good? 2 continuous layers, parietal peritoneum, visceral peritoneum. You get the theme now? Okay, let's move on. You can read that. Peritoneal cavity. No, the space in between it is called the peritoneal space. Has a fluid. Guess what the fluid's called? Peritoneal fluid. Okay, what is it when it's infected? Peritonitis. Yeah, sometimes they call it sepsis, but peritonitis. Okay, now we're talking about regions. Do tic-tac-toe. 2 parallel lines, 2 parallel lines. Yes, you get 9 little regions, and that's how we're going to do it. They break your abdominal pelvic cavity into quadrants, which means it's you put a cross on there. Okay, you put a cross, and you have quadrants. You do tic-tac-toe, you have regions. That's the one I want you to know, not the quadrants. Well, quadrants just upper left, lower left, that kind of stuff. Okay. See, I said there was 4 quadrants. You don't have to do that. I put it in black. I don't want you to know that. Okay. I mean, I'd like you to know it, but I'm not going to test you on it. I'm going to test you on the green. Okay. Here we go. And you're going, oh my God, how am I going to learn all that? Patience, patience, grasshopper. Okay. Do you know what chondra means in Latin? Right there. Chondra means cartilage. Do you know what hypo means? Hypo means below. Hyper means above. So hypo, I keep losing a little arrow. Hypo, below the cartilage of the ribs. The ribs are called costal cartilage. Below it is called hypochondriac, right here. This region, the upper right and left side of your abdominal pelvic area is called hypochondriac region. Right, left. There's two of them. Right hypochondriac region, left hypochondriac region. Okay, now don't go down the middle yet. Don't go down the middle. Okay, now what's your lower back called? Don't wait for me. Pause it. Tell me, what is your lower back called? Called your lumbar region. Called your lumbar region. Okay, look at this. Left, right, lumbar region. Okay, take your lower back, wrap it around. That's about where it's at. Okay, now remember when I told you to push your thumbs in? What bone were you touching? You're going, oh no, just tell me. I asked you to pause it and do it. Poke your thumbs in and feel that bone because that separated the abdominal from the pelvic region. Yes. We said that was on the innominate bone. The dominant bone had three bones, ilium, ischium, and pubis. The iliac is that top one, which is called the iliac crest. So it's the crest of the ilium. Okay. That being said, look at this. Left iliac, right iliac. You know where it's at. You touched it. Yeah. Okay. So we got the sides. There's 6 of them right there. Hypochondriac, lumbar, iliac. Good. Okay. Now let's go to the middle. Let's go to the dead center in the middle. Umbilical. You know your umbilical cord? Yes? And when your umbilical cord fell off, you ended up with a belly button. Okay? So that part right there in the center, umbilical region. Okay? Now, Latin for stomach is gastric. Another word for hyper means above, hypo means below. Epi means above too. Okay? So epigastric is above the stomach. So you see the liver right here. So there's the stomach. Above it is the epigastric, umbilical. Guess what the bottom one is? Hypogastric. That means way down below. There's your 9. Okay, I'm going to test you on this. I'm going to say, what is where? Look at this picture. I won't use anything but this picture. Okay? So for an example, is the liver located in the epigastric, the right hypochondriac, the left hypochondriac, or the left iliac? Now you're just going, what? It's located in the first 3 that I said. 1, I gotta get my arrow. 1, 2, 3. But it sure and heck ain't down there. Okay, good. Okay, moving on. Moving on. I put the quadrants in here just so you can see them. There they are. Boom, cross, there it is. We're not going to use it. Okay? Right, upper, right, lower, left, upper, left, lower. Okay. All right, now we're going to get into motions. What I'm going to do is I'm going to describe the motion, and then I'm going to describe it, give you words, then I'm showing you a picture. Okay? You're going to need to know these guys. Okay? You can either sit down and learn them, or you can learn them as you go. Got it? Got it? So now, when this is not in chapter 1, this is in chapter 5, towards the back end of that chapter. Okay, so if you want to go to the book, you want to flip open your book right now, go to chapter 5, toward the back end, and you'll see the same thing that's going on here. Okay? Okay, whenever you increase or decrease the angle between 2 bones, guess what that's called? You decrease the angle. Flexion. Flexion. When you increase the angle, flexion, there you go. I wrote it for you. Flexion, so you know how to spell it. Extension is when you increase the angle. Okay? So when you decrease the angle, it's flexion. When you increase the angle, it's called extension. When you go past extension, it's called hyperextension. Some places on our body, we can hyperextend. Some places we can't, okay? So if your hand is like this, I'm gonna show you this. Here we go. Flexion, you see the angle decrease? Extension, do you see the angle increase? Hyperextension. Remember, going from anatomical position. You get it? So you can flex your head, flex, you decrease the angle, extend, hyperextend. You see? Some places you can't hyperextend. You can't hyperextend your elbow. You can't hyperextend your knee. Good? Well, you can, I guess. That's called an injury. Lateral flexion is when you bend at the waist. So when you bend at the waist like this, okay, you bend over. What the heck were those things called, those exercises? They weren't called crunches. I don't know. Bend at the waist, okay? I'll tell you how long it's been since I've done it. Abduction, when you move away from the midline. Example. See how I move that away? That action is called abduction. I moved away from the midline, abduction. I'm not going to stand up because you won't be able to see me, but my leg do the same thing. As you're standing there and you move your leg away from you, not forward, to the side, that is abduction. When you move it back, it's called adduction. So when I move it closer together, adduction, adduction. Circumduction is when you go around a point. For example, I'm going to circumduct my finger. That disappeared. That's pretty cool. Watch. I can't get to do it anyway. You can circumduct your finger. You can circumduct your wrist. You can leg, circumduct my arm. So figure you have a pin sticking out there and you're going around it. Now, if you look at those last three, duction, duction, duction. Do you see it? Ab, move away. Add, move close. Circum, go around. Got it? There you go. There you go. And ask you some of those on exam. Hyperextension. I got pictures. I call this dude over here Bubba. Doesn't he look like Bubba? Yeah. Yeah. Bubba likes football. Okay, flexion. See, what they're showing you is flexion is decreasing the angle, extension is increasing the angle. Then flexion using the head, extension back to upright anatomical position, and then hyperextension is going the other way. Good? Yeah, that's Bubba. Okay, we can do it with our hand. Okay, anatomical position, your hand straight. Flexion, extension, hyperextension. You can't do it with your feet. That's why it says flexion, extension only. Good. All right. This is Bubba's sister. Anyway, you see how she's bending at the waist to the side? That's lateral flexion. Lateral flexion. Bending to the side. Okay. See how that flexion, because you see how the angle, see how the angle changed, got smaller here? Smaller. Abduction, adduction. Here's grandma. Here's grandma. Okay. Grandma's going to show you abduction, moving your arms away from the midline, aren't you? They were down in anatomical position. You move them out, that is ab. You move them back, that is add. You can do the same thing with your leg. Okay. That's what that one shows you. Okay. Abduction, adduction, I showed you that one. You can do it with your wrist, you can do it with your fingers. Okay. Just means moving away from the midline or moving towards the midline. Circumduction, moving around. Okay, we got three ductions: abduction, adduction, and circumduction. Okay, so it's showing you moving your leg and your arm. Okay, you can do the same thing with your finger. Okay, as long as you move it around a central point, it is called circumduction. Okay, rotational motion. Okay, rotation, rotation. Say no to drugs. Say no to the coronavirus. Say no to rioting. Okay? That is rotation. So no. This is, you see where it says atlantoaxial joint? Okay, your first two vertebrae are, your vertebra in your neck are called cervical vertebrae. The first two are the atlas and the axis. That's how we got the name. And that's where you pivot on. Got it? All right. Lateral rotation. Remember Bubba's sister? No, that was lateral flexion. Lateral rotation, moving to the outside. Medial rotation, moving inside. Pronation, supination. I told you this one once before. Remember anatomical position? Your thumbs are pointed outwards. Well, when you move your hand around the other way, so when you flip your hand over, okay, that is called pronation. It's called pronation. When you move it the other way, it's called supination. Okay, okay, good. There's grandma. No, see how she moves side to side. Now, lateral rotation, they're talking about the arm to the body. You can do it a little bit with your feet. You can do a little bit with your leg, medial and lateral. Okay, moving it to the outside, lateral, move it to the inside, medial. And then pronation, supination. You can't hardly see this here. It's hard to see your hand. I told you what it was, right? Yep. Okay, special movement, special. Like the way your family sees you, you're special. Depression, elevation. Okay. You know when you shrug your shoulders, you go yep, elevation, depression. Okay. And you've seen people that are depressed. When you see somebody else, well, what's wrong with you? You look depressed. How do you know that? Those shoulders are down. That's depression, elevation. These are oddballs. These are special. Dorsiflexion, plantar flexion. Only one this applies to is your foot. Your foot does not extend. It only flexes. Okay? Because you're going to, remember, you're standing upright, your foot down like that. Okay? So when you bend it up like this, point your toes towards your nose, that is called dorsiflexion. Okay? Remember, anatomical position, you're flat. And when you do this, you're decreasing the angle. That is called plantar flexion. Your plantar is your bottom part of your foot. Inversion, eversion. Easy way to remember this one. Inversion is instep, your instep. So if you wanted to look at your instep, that's the inside of your foot, the arch of your foot, you're looking down at that. You had to invert your foot to do that. Eversion is when you try and look out to the side. It doesn't work too good because as soon as you do that, you end up falling over. Yeah. But if you wanted to look at the outside of your foot, you'd have to twist your foot this way and you would be everting it. Good, good. Protraction, retraction, only one place in your body, your jaw. Okay? Protraction is an underbite. Got it? Retraction, Bucky Beaver, beaver teeth. Okay? So watch the jaw. Protraction, retraction. Like that, like that. That's why I did that. Pretty good. Opposition, only one place in the body. That's why these are special. The reason you are listening to me right now is because of two things evolutionarily. One is the brain, and two is the thumb. We had an opposable thumb. That means we can manipulate things. What the opposable thumb was is so we could get out of dodge. When we were being chased by a predator, think about it this way. When you're being chased by a predator, no. When anything is being chased by anything, all you got to do is worry about them going right, left, or straight, correct? Chances are, if you break right and your predator, something's about ready to eat you, breaks right, you're dead, okay? That means you can't reproduce. So what we did is we went up into trees and we were called brachiators. We used to grab limbs and move through the trees. What did that do? It isn't anymore you're going right, left, straight. You're going right, left, straight, up, down, angles, made it harder to capture. If you've ever seen a bunch of monkeys in the trees, when they get spooked, they're all over the place. You can't even watch them with your eyes. That's because they're brachiators. They have an opposable thumb, okay? That's what all the old primates did. They got an opposable thumb. This rocketed us because we could escape our predators, we could reproduce, we could make tools, and we could make weapons. So when we have that opposable thumb nailed down, we made a weapon, and when something's chasing us, we just turn around and killed it. Problem resolved. Okay? Anyway, that's opposition. Opposable. Okay? I opposed. See how I opposed it? Here's my fingers. I can oppose it. There you go. There you go. Here's pictures. Elevation, depression, protraction, retraction, inversion, eversion, and there's opposable. We good? You can pause this. I'm not going to go any longer on it. Hey, guess what? We're done. We're done. Okay? So I'm going to sign off. I got to get this thing over here. I'm going to sign off, and this will be that lecture. Okay? This will be that lecture. And then the next one coming up, let me look. I got my little list here. If you look at your syllabus, remember the one that has the dates and what we're doing? We did the introduction. Now this is for lecture. Lab, I got something else planned for you. We do cavities, planes, directions. We did that one. So we did 2 of them on your syllabus. The introduction to anatomy was cavities. We're supposed to do the cavities first and then do the introduction. I put them together. Okay. We're going to do, oh boy. We're going to go to chapter 2, which is, I say, oh boy, because it's cell membrane. It's a long one. Okay. We're going to talk about cell membrane diffusion, osmosis, all kinds of stuff. Okay. That's what's coming up. Have a good day. Next time you're going to see me, we're going to be talking about something in lab. Okay. We've done the metric system and we're going to do the microscope. Okay. All righty. Let me stop this thing. See ya.